Hey ultrasound besties, let's talk about the flow of blood in the human heart. So deoxygenated blood flows into the right atrium through the superior vena cava and the inferior vena cava. So once that right atrium gets full of blood, it has to go somewhere, right? So in between the right atrium and the right ventricle, you have the tricuspid valve. So once that right atrium is full, that valve opens up and allows that blood to pool into the right ventricle. So once that right ventricle is full, guess what? The tricuspid valve closes and another valve opens. So the pulmonary valve, which flows into the pulmonary artery, actually opens and allows that blood to flow into the lungs. So an easy way to remember what specific artery and what specific valve is closest to the one leading towards the lungs, just think about it this way, all right? In medicine, when we talk about the lungs, we use the word pulmonary. So pulmonary relates to the lungs. So, so the veins or the arteries or the valves coming off of the lungs will be called pulmonary. So we got the pulmonary valve, right? The blood flows through there. And then once it goes through that valve, it enters the pulmonary artery. So very super easy to remember. Then it goes into the lungs and it gets oxygenated, But once it's oxygenated, it needs to go somewhere, right? So it goes into the left atrium and it flows in through the pulmonary, again, pulmonary related to the lungs, the pulmonary veins. So once that left atrium is full, again, it has to go somewhere, right? So there ends up being a valve that's in between the left atrium as well as the left ventricle. And that valve is called the mitral valve. So once that left atrium is full, the valve opens, and that's the mitral valve, and it flows into the left ventricle. Now the left ventricle, once it's full, the mitral valve will close and another valve will open. And that's gonna be the aortic valve. Easy way to remember it. Once it leaves the left ventricle, it has to go somewhere, right? It's going towards the aorta, so the aortic valve. So once it goes through that valve, it heads over to the aorta, goes through the different branches, and then it goes all over the body, and then it comes back and the cycle is repeated again. An easy way to remember valves, their purpose, I guess you can say, think of it kind of like a bouncer or security. All right, so you normally have a bouncer or security when you want to let people in and control who comes out and in, right? So the same way with the valves. You want to let all that blood out through the valves, and you don't want that to come in because you don't want that backwashing back into the atrium. So that is the goal. That is the goal of the valves, to make sure nothing backwashes, that everything circulates. So let me know if you guys have any questions, and until next video.